8.10 Anticonvulsants. Medications used for seizures are called anticonvulsants or anti-seizure drugs. Anti-seizure drugs stabilize cell membranes and suppress the abnormal electric impulses in the cerebral cortex. These drugs prevent seizures but do not provide a cure. Anti-seizure drugs are classified as CNS depressants. There are many types of medications used to treat seizures such as phenytoin, phenobarbital, benzodiazepines, carbamazepine, valproate, and levetiracetam. There are three main pharmacological effects of anti-seizure medications. First, they increase the threshold of activity in the motor cortex, thus making it more difficult for a nerve to become excited. Second, they limit the spread of a seizure discharge from its origin by suppressing the transmission of impulses from one nerve to the next. Third, they decrease the speed of the nerve impulse conduction within a given neuron. Some drugs work by enhancing the effects of the inhibitory neurotransmitter gamma-aminobutyric acid, which plays a role in regulating neuron excitability in the brain. Gabapentin, although structurally similar to GABA and classified as an anticonvulsant, is commonly used to control chronic neuropathic pain. Neuropathic pain is defined by the International Association for the Study of Pain as pain caused by a lesion or disease of the somatosensory nervous system. 3. An example of neuropathic pain is tingling or burning in the lower extremities that often occurs in clients with diabetes. Phenytoin. Phenytoin, which was discovered in 1938, was the first anti-seizure medication and is still being used to control seizures. Mechanism of action. Phenytoin improves evidence of seizures by interfering with sodium channels in the brain, resulting in a reduction of sustained high-frequency neuronal discharges. 1. M-sequitian L, Voljoin DiMaggio K, Winton M, and Jaeger J. Pharmacology, a patient-centered nursing process approach. pp. 227-305. Elsevier. 2. Lilly L, Collins S, and Snyder J. Pharmacology and the nursing process. pp. 246-272. Elsevier. 3. Murnian B.P. Neuropathic pain, current definition and review of drug treatment. Australian prescriber, 41, 60-63. 4. M-sequitian L, Voljoin DiMaggio K, Winton M, and Jaeger J. Pharmacology, a patient-centered nursing process approach. pp. Indications for use. Phenytoin is indicated for the treatment of tonic-clonic and psychomotor seizures and for the prevention and treatment of seizures occurring during or following neurosurgery. Nursing considerations across the lifespan. Phenytoin should not be administered to pregnant women because it will cause harm to the fetus. When given intravenously, there is a black box warning that the rate of administration should not exceed 50 milligrams per minute in adults and 1 to 3 milligrams kg/min in pediatric clients because of the risk of severe hypotension and cardiac arrhythmias. Careful cardiac monitoring is needed during and after administering intravenous phenytoin. Phenytoin has a narrow therapeutic drug level, usually between 40 to 80 L, so serum drug monitoring is required. Serum levels of phenytoin sustained above the therapeutic range may produce confusional states referred to as delirium, psychosis, or encephalopathy. Accordingly, at the first sign of acute toxicity, serum levels should be immediately checked. Abrupt discontinuation can cause status epilepticus, so in the event of an allergic or hypersensitivity reaction, rapid substitution of alternative therapy may be necessary. Use with caution in clients with renal or hepatic impairment. Elderly clients may require dosage adjustment. There are many potential drug interactions with phenytoin. Read drug label information before administering. Phenytoin is extensively bound to plasma proteins and is prone to competitive displacement. Phenytoin is metabolized by hepatic cytochrome P450 enzymes, so it is susceptible to inhibitory drug interactions, which may produce significant increases in circulating phenytoin concentrations and enhance the risk of drug toxicity. Adverse side effects. Serious and sometimes fatal dermatologic reactions, including toxic epidermal necrolysis and Stevens-Johnson syndrome, have been reported with phenytoin treatment. The onset of symptoms is usually within 28 days but can occur later. Phenytoin should be discontinued at the first sign of a rash. Drug reaction with eosinophilia and systemic symptoms has been reported in clients taking antiepileptic drugs, including phenytoin. Some of these events have been fatal or life-threatening. DRESS typically presents with fever, rash, lymphadenopathy, and/or facial swelling in association with other organ system involvement. These findings should be immediately reported to the provider. Acute hepatotoxicity has been reported with phenytoin. These events may be part of the spectrum of DRESS or may occur in isolation. Hematopoietic complications, some fatal, have occasionally been reported in association with the administration of phenytoin. These have included thrombocytopenia, leukopenia, granulocytopenia, agranulocytosis, and pancytopenia with or without bone marrow suppression. The most common adverse reactions encountered with phenytoin therapy are nervous system reactions and are usually dose-related. Reactions include nystagmus, ataxia, slurred speech, decreased coordination, somnolence, and mental confusion. Client teaching and education. Clients should be advised to take medications as directed and that doses should be evenly spaced throughout the day. It may take several weeks to obtain the desired medication effect. Abrupt withdrawal of medication may cause status epilepticus. Clients should avoid alcohol and other CNS depressants while taking anticonvulsant drug therapy. Additionally, diabetic clients should monitor their blood glucose levels carefully. Phenytoin medication card. Now let's take a closer look at the medication card for phenytoin. Medication cards like this are intended to assist students to learn key points about each medication. Because information about medication is constantly changing, nurses should always consult evidence-based resources to review current recommendations before administering specific medication. Basic information related to each class of medication is outlined below. Prototype or generic medication examples are also hyperlinked to a free resource at DailyMed. On the home page, enter the drug name in the search bar to read more about the medication. 540 central nervous system regulation, mood, and cognition. Elderly clients may require dosage adjustment. Indications: decrease or prevent seizure activity. Contraindications: pregnancy, heart block, several drug interactions. Side effects. Common adverse reactions. Reactions include nystagmus, ataxia, slurred speech, decreased coordination, somnolence, and mental confusion. Safety: serious fatal effects. Dermatologic reactions: 10. SJS, DRESS, hematopoietic complications, acute hepatotoxicity. Nursing considerations: requires serum drug monitoring. Taper dose, do not stop abruptly. Monitor blood glucose closely. Avoid alcohol and CNS depressants. Must administer slowly. Discontinue at first sign of a rash. Levetiracetam. Levetiracetam is indicated as adjunctive therapy in the treatment of partial onset seizures in clients 12 years of age and older with epilepsy. It is generally well tolerated. Mechanism of action. The exact mechanism of action is unknown. This medication may interfere with sodium, calcium, potassium, or GABA transmission. Indications for use. Levetiracetam is used for partial onset seizures in clients with epilepsy. Nursing considerations across the lifespan. Plasma levels can gradually decrease during pregnancy and should be monitored closely. Safety and effectiveness. In pediatric clients 12 years of age and older have been established. Levetiracetam, immediate release in solution, can be used in clients as young as 1 month. Levetiracetam should not be stopped abruptly or withdrawal seizures may occur. Use with caution in clients with renal impairment. Adverse side effects. Behavioral abnormalities including psychotic symptoms, suicidal ideation, irritability, and aggressive behavior have been observed. Monitor clients for psychiatric signs and symptoms. The most common adverse reactions are somnolence and irritability. Advise clients not to drive or operate machinery until they have gained sufficient experience on levetiracetam. This drug can cause anaphylaxis or angioedema after the first dose or at any time during treatment. Serious dermatological reactions, including Stevens-Johnson syndrome and toxic epidermal necrolysis, have been reported, as well as coordination difficulties and hematologic abnormalities. Client teaching and education. Medications should be taken as directed and may cause increased dizziness and somnolence. Clients, family, and caregivers should also monitor carefully for suicidality during medication therapy. Levetiracetam medication card. Now let's take a closer look at the medication card for levetiracetam. Because information about medication is constantly changing, nurses should always consult evidence-based resources to review current recommendations before administering specific medication. Medication card 8.1002. Levetiracetam generic name. Levetiracetam prototype brand name. Keppra mechanism. Exact mechanism unknown. May interfere with sodium, calcium, potassium, or GABA transmission. Therapeutic effects: reduction of seizure activity administration. 542. Central nervous system regulation, mood, and cognition. Use cautiously if renal impairment. Safe for children 12 and older. Adjunctive therapy in the treatment of partial onset seizures. Contraindications: clients who are suicidal, clients with altered hematology. Side effects: behavioral mood changes, somnolence, fatigue, and irritability. Coordination difficulties, safety, serious fatal effects, anaphylaxis or angioedema, dermatologic reactions, 10, SJS, hematopoietic complications. Taper dose. Do not stop abruptly or seizures may occur. Monitor carefully for suicidality during medication therapy. Monitor for safety, mobility, and falls risk. Gabapentin. Gabapentin is indicated as an adjunct treatment for partial seizures, but is most commonly used to treat neuropathic pain. Mechanism of action. The exact mechanism of action is unknown. It is structurally similar to GABA, but does not act on GABA receptors or influence GABA. Indications for use. Gabapentin is used for partial seizures and neuropathic pain. Nursing considerations across the lifespan. This drug can cause harm to the fetus of pregnant women. Gabapentin use in pediatric clients with epilepsy 3 to 12 years of age is associated with the occurrence of central nervous system to related adverse events. The most significant of these can be classified into the following categories. 1. Emotional lability. 2. Hostility, including aggressive behaviors. 3. Thought disorder, including concentration problems and change in school performance. And 4. Hyperkinesia. In elderly clients, peripheral edema and ataxia tends to increase in incidence with age. Fall precautions should be considered. Antiepileptic drugs should not be abruptly discontinued because of the possibility of increasing seizure frequency. Adverse side effects. Antiepileptic drugs, including gabapentin, increase the risk of suicidal thoughts or behavior in clients taking these drugs for any indication. Clients should be monitored for the emergence or worsening of depression, suicidal thoughts or behavior, and/or any unusual changes in mood or behavior. Drug reaction with eosinophilia and systemic symptoms, also known as multi-organ hypersensitivity, has been reported in clients taking antiepileptic drugs, including gabapentin. Some of these events have been fatal or life-threatening. DRESS typically, although not exclusively, presents with fever, rash, and/or lymphadenopathy in association with other organ system involvement. If these symptoms occur, they should be immediately reported to the provider. Gabapentin may cause dizziness, somnolence, and other symptoms and signs of CNS depression. Clients should be advised neither to drive a car nor to operate other complex machinery until they have gained sufficient experience on gabapentin to gauge whether or not it affects their mental and/or motor performance adversely. Client teaching and education. Clients receiving gabapentin therapy should take medication as directed and be careful not to exceed dosage recommendations. Clients should not take gabapentin within 2 hours of antacid medications. Additionally, gabapentin may cause increased drowsiness and dizziness. Clients, family, and caregivers should also monitor for suicidality. Gabapentin medication card. Now let's take a closer look at the medication card for gabapentin. Because information about medication is constantly changing, nurses should always consult evidence-based resources to review current recommendations before administering specific medication. Medication card 8.10.3, gabapentin, generic name gabapentin. Prototype brand name Neurontin. Mechanism, the exact mechanism of action is unknown. It is structurally like GABA but does not act on GABA receptors or influence GABA. Therapeutic effects. Reduction in seizures. Reduction in neuropathic pain. Administration. Administer first dose at bedtime to decrease dizziness and drowsiness. Caution in use with children and elderly. Indications. Adjunct treatment for partial seizures, most often used to treat neuropathic pain. Contraindications, pregnancy. Side effects, increased suicidal ideation, immediately report fever, rash, and/or lymphadenopathy, CNS depression, dizziness, somnolence, and ataxia. DRESS, safety, consider false precautions for elderly, monitor closely for suicidal ideation and DRESS syndrome. Nursing considerations. Do not take within 2 hours of antacid medications. Taper dose. Do not stop abruptly. Monitor for worsening depression, suicidal thoughts or behavior, and/or any unusual changes in mood or behavior. A 70-year client in a long-term care center has diabetes and has been prescribed gabapentin for neuropathic pain. 1. The client states, I have never had a seizure. Why has the doctor prescribed an anti-seizure medication for me? What is the nurse's best response? 2. The nurse plans to implement additional fall precautions for this client. Why are additional fall precautions needed? 3. What potential adverse effects should the nurse plan to monitor? What adverse effects would require immediate notification of the provider? Note, answers to the critical thinking activities can be found in the answer key sections at the end of the book. 801. 1. Anti-Parkinson medications. Parkinson's disease is believed to be related to an imbalance of dopamine and acetylcholine and a deficiency of dopamine in certain areas of the brain, so drug therapies are aimed at increasing levels of dopamine and/or antagonizing the effects of acetylcholine. Drug therapy does not cure the disease, but is used to slow the progression of symptoms. Common medications used to treat Parkinson's disease are carbidopa, levodopa, selegiline, and nimantadine. Carbidopa, levodopa. Carbidopa levodopa is the most common drug used to treat Parkinson's disease and is usually started as soon as the client becomes functionally impaired. Mechanism of action. Administration of dopamine is ineffective in the treatment of Parkinson's disease because it does not cross the blood-brain barrier, but levodopa, the metabolic precursor of dopamine, does cross the blood-brain barrier and presumably is converted to dopamine in the brain. Carbidopa is combined with levodopa to help stop the breakdown of levodopa before it is able to cross the blood-brain barrier. Additionally, the incidence of levodopa-induced nausea and vomiting is less when it is combined with carbidopa. Indications for use. Carbidopa levodopa is indicated for Parkinson's disease. It is also used to treat restless leg syndrome. Nursing considerations across the lifespan. Carbidopa levodopa is recommended for use in clients older than age 18. It can take several weeks to see positive effects, and this should be explained to clients and their caregivers. The drug is contraindicated for use with MAUIs. All clients should be observed carefully for the development of depression with concomitant suicidal tendencies. Clients taking carbidopa and levodopa have reported suddenly falling asleep without prior warning of sleepiness while engaged in activities of daily living. Clients should be advised to exercise caution while driving or operating machines during treatment with carbidopa and levodopa. Sporadic cases of symptoms resembling neuroleptic malignant syndrome have been reported in association with dose reductions or withdrawal of certain anti-Parkinsonian agents. Therefore, clients should be observed carefully when the dosage of levodopa is reduced abruptly or discontinued. Periodic evaluations of hepatic, hematopoietic, cardiovascular, and renal functions are recommended during extended therapy. The most common adverse effect of carbidopa-levodopa is dyskinesia, which may require dosage reduction. Clients should be instructed to plan their meal times around medication times to improve their ability to use their utensils and to avoid diets high in protein due to decreased absorption of the medication. Adverse side effects. Hallucinations and psychotic-like behavior have been reported with dopaminergic medications. Clients taking dopaminergic medications may experience intense gambling urges, increased sexual urges, intense urges to spend money or indulge in binge eating, and/or other intense urges, and the inability to control these urges. These urges stop when the dosage is decreased or the medication is discontinued. A higher risk for melanoma has been reported. Occasionally, dark red, brown, or black color may appear in saliva, urine, or sweat after ingestion of carbidopa and levodopa. Although the color appears to be clinically insignificant, garments may become discolored. Client teaching and education. Clients should take their medications at regular intervals as directed. If gastric irritation is experienced, clients may eat food shortly after taking medications, but high-protein foods may impair drug action. Medications may cause increased drowsiness, dizziness, and orthostatic changes. Clients should carefully assess their skin to monitor for new lesions, and any abnormality should be reported to the healthcare provider. Carbidopa-levodopa medication card. Now, let's take a closer look at the medication card for carbidopa-levodopa. Medication cards like this are intended to assist students to learn key points about each medication. Because information about medication is constantly changing, nurses should always consult evidence-based resources to review current recommendations before administering specific medication. Basic information related to each class of medication is outlined below. Prototype or generic medication examples are also hyperlinked to a free resource at DailyMed. On the homepage, enter the drug name in the search bar to read more about the medication. Prototype, brand name, Sinemet. Therapeutic effects, reduced progression of symptoms of Parkinson's disease. Administration, avoid high-protein diets on to monitor hepatic, renal, and hematopoietic functions in use in clients over 12% if gastric irritation. Eat food shortly after to treat Parkinson's and is usually started as soon as the client becomes functionally impaired. Indications, also used to treat restless leg syndrome. Contraindications, contraindicated for use with MAUIs. Side effects, depression, suicidal ideation, hallucinations, and intense urges. Somnolence and fatigue. NMS symptoms, dyskinesia, discolored body fluids, hypomobility with long-term use, higher risk for melanoma. Safety, observe carefully for depression with suicidal ideation. Nursing considerations, can take several weeks to see effects. Taper dose when stopping. Plan meal times around med times. Monitor for new lesions. Monitor for sudden somnolence and depression. Selegiline. Selegiline is often used in conjunction with carbidopa-levodopa when clients demonstrate a deteriorating response to this treatment. It is helpful to control symptom fluctuations. Mechanism of action. Selegiline inhibits MAO-B, blocking the breakdown of dopamine. Indications for use. Selegiline capsules are indicated as an adjunct in the management of Parkinsonian clients being treated with levodopa, carbidopa, who exhibit deterioration in the quality of their response to this therapy. There is no evidence from controlled studies that selegiline has any beneficial effect in the absence of concurrent levodopa therapy. Nursing considerations across the lifespan. Large doses of selegiline may inhibit MAO-A that promotes the metabolism of tyramine in the GI tract, which can cause a hypertensive crisis. Adverse side effects. Side effects are dose-dependent, with larger doses posing a hypertensive crisis risk in conjunction with the consumption of food or beverages with tyramine. Higher doses can increase the risk for hypertensive crises. Client teaching and education. Clients should be advised to avoid foods high in tyramine. Additionally, medications may cause increased drowsiness, dizziness, and orthostatic changes. If clients experience abnormal behaviors such as hallucination, sexual urges, gambling, etc., this should be reported promptly to the healthcare provider. Selegiline medication card. Now let's take a closer look at the medication card for selegiline. 8. This work is a derivative of Daily Med by U.S. National Library of Medicine in the public domain. Medication card 81112, selegiline. Prototype, brand name, Eldepril. Mechanism, selegiline inhibits MAO-B, blocking the breakdown of dopamine. Therapeutic effects, reduction in progression of Parkinson's disease symptoms. Avoid foods with tyramine. Indications, used in conjunction with carbidopa-levodopa when clients demonstrate deteriorating response to this treatment. Contraindications. Tyramine. Side effects. Side effects are dose-dependent, with larger doses posing a hypertensive crisis risk if there is consumption of food or beverages with tyramine. Nursing considerations. May cause increased drowsiness, dizziness, and orthostatic changes. Report any abnormal behaviors to HCP. Amantadine. Amantadine is used in the early stages of Parkinson's disease, but can be effective in moderate or advanced stages in reducing tremor and muscle rigidity. Mechanism of action. The exact mechanism of action is unknown. Amantadine is an antiviral drug that acts on dopamine receptors. 10. MC Quishan L. Voljoin DiMaggio K. Winton M. and Jaeger J. Pharmacology, a patient-centered nursing process approach. pp. 227 to 305. Elsevier. Indications for use. Amantadine is used for Parkinson's disease, medication-induced extrapyramidal symptoms, and influenza A. Nursing considerations across the lifespan. Use cautiously with renal impairment. This drug may cause suicidal ideation and should not be stopped abruptly or can cause Parkinsonian crisis. Neuroleptic malignant syndrome has been reported in association with dose reduction or withdrawal of amantadine therapy. Adverse side effects. Suicide ideation, congestive heart failure, and peripheral edema can occur. This drug can cause intense gambling urges, increased sexual urges, intense urges to spend money uncontrollably, and other intense urges with an inability to control them. There is an increased risk of melanoma. Adverse reactions reported most frequently are nausea, dizziness, and insomnia. This drug can also cause anticholinergic side effects, impaired thinking, and orthostatic hypotension. Client teaching and education. Clients should take medications as directed and ensure they do not skip or double doses. Medications may cause drowsiness, dizziness, and orthostatic blood pressure changes. Clients should avoid using this medication with OTC cold medications or alcoholic beverages. If clients, family, or caregivers note worsening depression or suicidality, this should be reported immediately to the healthcare provider. Amantadine medication card. Now let's take a closer look at the medication card for amantadine. Because information about medication is constantly changing, nurses should always consult evidence-based resources to review current recommendations before administering specific medication. Therapeutic effects. Reduction in progression of Parkinson's disease symptoms. Administration. Monitor renal function. Monitor mental state, assess blood pressure. Indications. Used in the early stages of Parkinson's disease but can be effective in moderate or advanced stages in reducing tremor and muscle rigidity. Contraindications. Known hypersensitivity. Side effects. Increased suicidality and urges. CHF and peripheral edema. Neuromalignant syndrome. Orthostatic hypotension. Nausea, dizziness, and insomnia. Anticholinergic side effects. Nursing considerations. Taper dose carefully. Monitor BP. Monitor for suicidal thoughts or behavior and/or any unusual changes in mood or behavior. Clinical reasoning and decision-making activity 8.1.1. A 76-year-old client in a long-term care center has developed a shuffling gait with a stooped posture, along with a hand tremor at rest. The nurse practitioner prescribed carbidopa-levodopa. 1. The nurse knows that Parkinson's disease is related to dopamine, but dopamine can't cross the blood-brain barrier. How will carbidopa-levodopa assist with dopamine levels? 2. The client states, I am looking forward to spending next weekend with my grandson. He even said he would let me drive his new Mustang. What teaching should the nurse provide the client and his grandson regarding the new medication and his weekend plans? 3. The nurse reads that the most common side effect of carbidopa-levodopa is dyskinesia. What is dyskinesia? If it occurs, what is the likely treatment? Note, answers to the critical thinking activities can be found in the answer key sections at the end of the book. Interactive activity. An interactive HSP element has been excluded from this version of the text. You can view it online here, bmw.comsteady.ca, Ursing Pharmacology, p equal to 421,885p to 23. Interactive activity. An interactive HSP element has been excluded from this version of the text. You can view it online here, hpsopentext.coursingpharmacology, p equal to 421,385p to 24. Endocrine. 9.1 Metabolic Regulation Introduction. Learning objectives. 1. Understand the classifications and actions of endocrine system drugs. 2. Give examples of when, how, and to whom endocrine system drugs may be administered. 3. Identify the side effects and special considerations associated with endocrine system drug therapy. 4. Identify the considerations and implications of using endocrine system medications across the lifespan. 5. Apply evidence-based concepts when using the nursing process and clinical reasoning related to medications that affect the endocrine system. Effects and potential drug interactions associated with the use of key terms: A1C, adrenal medulla, aldosterone, antidiuretic hormone, basal insulin, blood osmolarity, diabetes insipidus, general adaptation syndrome, glycolysis, hormones, humoral stimuli,